This is the preceding circumstances page for the Firearm Violence Data Dashboard. On this page, it features data from the Maryland Violent Death Reporting System, or MVDRS, which is a statewide surveillance system managed by the Maryland Department of Health. All violent deaths are reviewed by data abstractors who are using data sources such as death certificates, medical examiner reports, and law enforcement reports. The data abstractors will determine what types of circumstances were present at the time of the violent death or directly preceding the violent death and are able to code and track all of the different circumstances. The first chart that you will see are the types of firearms used in firearm-related homicides as well as suicides. And you can see for the type of firearm that there are 3 categories that are shown. The first in gray are the handguns, and you can see for homicides by year as well as suicides by year, violent deaths where a handgun was used. In yellow, for a long gun, which includes firearms including rifles and shotguns, you can see the circumstances where a long gun was used in a violent death. And you can see that there were a significant number of long guns used in suicides. There's also in orange a category for an unknown type of gun. What is notable about these orange bands is in homicides, you can see that in the most recent years, that makes up the largest of the bands. But you will also see as time goes by that this category typically will grow shorter as the cases are closed and as more information is learned and the records are updated. In addition to the type of firearm used, there are other circumstances that are available based on the violent death records. There are different circumstances available for both homicides as well as suicides. And we should note that each violent death may have one or more of the different circumstances that are present. For suicides, the different circumstances that are collected and reported and shown here include whether the person who died had a current mental health or substance use treatment, had a history of mental health or substance use treatment, had a mental health problem or a physical health problem, or had a previous suicide attempt. And as you scroll over each of the data points by year, you can tell the information about the circumstances. There are different circumstances for suicides and homicides. For homicides, there is information about whether or not an argument preceded the violent death, whether or not drug involvement was involved in the violent death, whether there was a fight between 2 people or intimate partner violence, whether the violent death was precipitated by another crime, or whether this was a walk-by assault. And once again, we can scroll over the different data points to see the information.